A dent in a lumpectomy scar, what is that? This is what a dent in a lumpectomy scar may look like. It may also be referred to as scar depression, distortion, or deformity. In essence, there is an unfavorable cosmetic appearance after breast conservation treatment. At this point, I just want to say that not all lumpectomy scars have a dent. There are women who have lumpectomy scars which look like this, where there is minimal deformity or distortion, if any. In case it is not evident, here is her surgical scar, and this is the demarcation between normal and mildly hyperpigmented skin, which is the result of radiation treatment. This is what I term as restorative breast surgery. The patient's own uninvolved breast tissue is used to repair the defect that is created by surgically removing the cancer with a clear margin. Some surgeons may use the term oncoplastic breast surgery. Under this classification, the specific type of technique used is a volume displacement procedure. Regardless of the terms used, in order to achieve good cosmetic outcomes, pre-operative planning is essential. As an example, this patient came to see me after her diagnosis of breast cancer, and her surgeon told her that she needed a mastectomy. Her first surgeon performed a biopsy of her lump through a skin crease incision close to her armpit. Her first scar is indicated by the light blue arrow. This incision is not ideal for restorative surgery, so I had to design a special incision which would incorporate the first surgical scar and excise it. Her first scar was mildly infected and had opened up or undergone dehiscence by the time she came to see me. While this was the intended preoperative planning for the scar, I had to modify intraoperatively to ensure closure with minimal tension and also to allow some scar lengthening. We also note that I placed the scar within what would be the incision for a mastectomy, as indicated by the yellow arrow, should it become necessary if we failed to achieve clear margins. With careful attention to appropriate dissection, mobilization of tissue in layers, this was her final cosmetic outcome about a year after completing radiotherapy. By that time, the hyperpigmentation of the skin had settled and her skin color returned to normal. We will note that on occasion there may be a need to make a longer incision in order to effect the repair of the tissue defect that has been created by cancer removal with a margin of uninvolved tissue all around. Since the volume of tissue removed can be significant, it is necessary to use certain operative techniques to ensure that the shape of the breast is restored as much as possible. Some of these techniques are discussed in our other videos. Back to this patient, I am happy to say that she is still well without any evidence of recurrence, nearly 20 years after she was treated for breast cancer. As you see, not every patient has the same result, even though the scar may be in a similar position. Both these patients had radial incisions in the upper outer quadrant of the breast, but the final cosmetic appearance can be different. I can only say that I did not operate on the patient illustrated on the left. There are many factors to take into consideration in order to achieve a good cosmetic outcome, so please speak to your doctor about what kind of lumpectomy scar appearance you can expect after surgery and radiation is complete. Personally, I use a repertoire of different incision designs depending on the unique position of the cancer that each patient presents with. It just so happened that both these patients of mine had cancers in a similar position in the breast, that is, the upper outer quadrant, but the length of the incision is different for two reasons. Firstly, the distance of the cancer from the edge of the nipple was different. Secondly, the patient on the left had ductal carcinoma in situ, very early cancer which did not require treatment of the lymph nodes in the armpit, while the patient on the right had stage 2 cancer with involvement of the lymph nodes requiring removal of the axillary lymph nodes at the time of her treatment. Thank you for watching this video. You will find information in our other videos about breast conservation treatment, as well as the diversity of incision planning. It may be useful for women to note that the nature of breast-conserving surgery allows women to return to most of their usual activities within days after surgery. The difference in risk of surgical complications and recovery between breast conservation treatment and mastectomy will also be discussed in our other videos. We hope you will join us there too. If you wish to have more detailed information on lumpectomy scars, please click on the link given in the description below. Also, if this has been helpful, kindly like, share, comment, and subscribe so that together we can reach a wider audience and help more women understand the nuances of breast cancer surgical treatment. Until we come together again, take care.